Be here. So yes, just so folks who are listening in know, my name is Yara Sachs, and I'm Canada's Minister of Mental Health and Addictions and Associate Minister of Health. And I'm thrilled to be back with you speak again.
Yes, we've gotten to know Minister Yara Sachs from a few different occasions. We've had the opportunity to meet with you in Newmarket, and you were at our recent community event, which was awesome. So yeah, you for those who don't know, would you introduce what you do as a Canadian minister?
Of course. So obviously, as the Minister of Mental Health and Addictions, the primary focus of my work each and every day is helping and addressing the needs of Canadians when it comes to their mental health, but also understanding that substance use and mental health often go hand in hand. We use substances in our lives for enjoyment, but we also use them as coping mechanisms. So, they really are together in our lives on a day-to-day basis. But I'm also a mom. So, like many parents, and I'm the single mom to two amazing teenage daughters, like a lot of parents, mental health comes up in our house all the time. And I have a front row seat to how young people are feeling in terms of there's a lot of anxiety about the future of the world that we live in. That when you go on social media or when you go on the news and you see, young people today, they're confronted with climate change, they're confronted with global conflicts, and they're also confronted at home with, the costs of living, of finding a job, real financial stressors that today young people are grappling with in a much more profound way than perhaps we would have seen decades ago, or they're more aware of it. And we know that that can take a toll on the mental health of parents, of kids, of family units, of communities. So my job as the minister across Canada is to make sure that those services in mental health and substance use are available, that they're accessible, that they're equitable, that we are meeting people where they're at so that they can access those services when and where they need them, because waiting's just not an option, especially when it comes to our young people. So, working with the health systems in the provinces and territories, working with physicians, frontline workers, amazing young mental health advocates like you, Carson, and the folks at YouthSpeak really allows me to do the work that making sure that across the country, we are making sure that mental health is health and part of our healthcare system, and getting that work done with agreements with provinces and territories, with setting up the Youth Mental Health Fund, with setting up the 988, which we'll talk about later. So that's day-to-day life as a minister.
Wow, and like that's incredible because I feel like I relate to a lot of those things other than the motherhood piece. But yeah, like as someone who li lives in Canada who struggles with addiction and who struggles with various other mental health things, it is very true what you're saying, especially about wait times. There's a lot of stress and chaos that can come from being kind of forced to wait for services that you desperately need. I know that I've been privileged in a lot of ways that I was able to get the care that I needed in a timely manner, but that like again, I was privileged to get that. It doesn't mean everyone does. And hopefully we are doing our part here at You Speak.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca, where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.